So welcome everyone. This is Matt Petty. I'm Executive Director of PNHP. This webinar is on successful projects and practices, PNHP chapters and activists. We're joined today by Dr. Ann Setgas, who is Assistant Professor of Medicine at the University of Minnesota and a primary care physician at Health Partners. She, for some years, was co-chair of the Minnesota chapter of PNHP and has been a national PNHP board member for a number of years now. Dr. Jessica Sachs, and chair of our PNHP chapter there, known as Healthcare Justice, and she is a national board member. So with that, I will turn it over to Dr. Ann Setgas.
So thank you, Matt. Before I start, just want to make sure I can be heard well.
Can be heard.
Okay. So it's a real pleasure to get to do this webinar today. As Matt said, my name is Ann Setgast, and I co-chaired our Minnesota chapter of PNHP with Elizabeth Frost from 2006 when the chapter started until 2013. And what I've done today with this, I'm going to do half of the talk, and then Jessica will do another half, and then we'll allow the third 20 minutes for question and answer. And what I really attempted to do was reflect on our experience leading the Minnesota chapter, and I pulled out about 5 items which I think were very helpful in our success. So it's not really a how to do a chapter, but 5 kind of features of our chapter that I thought made us work quite well. So to start, we actually had quite a loose structure, hence the loosey-goose up in the top. We did have, like I said, structurally co-chairs, so Elizabeth and I led our chapter, but we did not have a formal board. I think there are pros and cons of this approach, but I think, and actually when we started out, I was much more interested in having a more formal structure than Elizabeth was. And in retrospect, I'm glad we did it the way she preferred, which was a looser structure, and I'm going to tell you why. So rather than a board, we did have on a year-to-year basis what we called a steering committee, which was a few members, and really that we asked to be on the steering committee. And the real purpose of them was for us to be saved from making large decisions alone. So, you know, if there was a question about how to spend a significant amount of money, for example, we didn't want to do that completely by ourselves. And so that was the main function of our steering committee. We just asked that those members on the steering committee be available quickly by email and willing to respond quickly to inquiries, and also obviously to attend events and meetings, but it wasn't a real formal, strong, or specific commitment on their part. So really we had a rather loose structure. We did have a treasurer who managed our finances, but that was it was a large role in that piece, but pretty specific. We also didn't have a strict membership definition or process for registering members. We had a chapter resolution, which I'm going to cover in the next couple slides, that was one of our main organizing tools, or still is. I'm using was because I'm no longer the co-chair, but the chapter, of course, is ongoing. And that, to be a member, really, all you needed to do was sign our resolution, or even just ask us to get on our email list, even if you didn't sign the resolution. So there wasn't any real formal process for becoming a member of the Minnesota chapter. We called you a member if you were on our list, basically. We did have regular chapter meetings over the years that we led the group. We, on average, met about 5.5 times a year. I went back and looked at our records. There were some years where we met 6 or 7 times, and other years 4 or 5 times. And I think one of the really important things, and this is why I have a picture of Dave Dvorak, who some of you may recognize in the bottom corner, is because our meetings never had any sort of closed board or closed steering committee meetings. Our meetings were always announced to the whole listserv and always open to anyone to come. And I think it was actually a huge advantage to do it this way, because this is how we met and acquired some of our most important and valuable members, really. So Dave Dvorak is an example of someone who, 2 or 3 years into our chapter we were well in the swing of things, and he just randomly showed up one day to a meeting and turned out, in retrospect, to be our most prolific speaker and writer, that the Minnesota chapter has actually had to this date. And there are other examples of major activists that just kind of randomly showed up. They're not people that we knew were even out there, but somehow they heard about the meeting and came. And so I just think having that kind of loose, open structure really allowed for a lot of fluidity in our activism and allowed people to kind of come and go as they liked. As we all know, physicians are generally a very busy group of people to try and organize and pin down on things. And so, we would have the experience where someone might be really active for a year or two and just do a ton of PNHP work, and then they'd kind of fall off for a while and sometimes show back up and sometimes not. But we felt like that was fine. It kind of, this fluidity allowed for us to maximize people's time and efforts when they had the availability. That structure also really facilitates resident and student involvement, medical students, because by definition, they're a really dynamic, fluid sort of group that's coming in and out of your setting. And so that structure really allowed for their involvement as well. So I mentioned our chapter resolution, which was one of our major organizing tools. This is how it looked online. We often also printed it and used it in paper form. This is a resolution that we used really constantly. What we would do anytime we went and spoke, and we collected signatures on it. And this is an example of our signature list. Sorry, the slide is a little bit blurry. You're not meant to be able to read these names. But the point of this piece of paper, or this screenshot, which is a screenshot of a paper that we would print, is what we would do is we would print this on the back of the resolution, and we just took it with us everywhere. So this list, in the beginning, when we first started a chapter resolution at the beginning, we started with 45 signers. And by this date, we had this particular screenshot has about 775 signers. And so we were very proud of this, and we would use this sheet in so many ways. So when we would go, for example, to meet with a legislator, we could hand this over and say, here are physicians in your state who support single payer. And when we would go to speak to physician groups or non-physician groups, we would hand this out and we would say, here's a list of, if it was a physician group, here's a list of your colleagues who are on board. And I think what this did for a lot of people in the audience or the recipients of the paper is they would find out that, it would sort of normalize single payer support, and they could look and see their colleagues and say, oh, wow, I didn't know so-and-so was a single payer supporter. So it really kind of just normalized support and made it okay to put yourself out there. It also had some prestige because we had some names of pretty prominent local physicians, and so I think that sort of provided some peer pressure for some people who might have otherwise not been comfortable putting their name on, that they would then feel like it was okay. So we used this a lot. Another example of the way we like to use this, we were, this is a story I've told before, but we were in a meeting with an aide for one of our U.S. Congress women, and she said, well, I just went to D.C. I was just in D.C. and I met with some Minnesota physicians. There were 10 of them, and they didn't support single payer at all. So I don't think there's physician support. And then we were able to just pull this resolution and list out and say, well, here's a list of 5 or 6 or whatever it was at the time, 100, Minnesota physicians who indeed do. So it was a really nice way to just show how much support we had and make it really public. How we got people on the list is we would reach out to, I do hear a fair amount of background noise. Matt, should we ask people to mute if they haven't?
Yeah, people could mute their handsets if they're on a phone. That would be great.
Okay, now it's quiet. Well, I'm hearing a little echo. Maybe that's myself. Anyway, we worked to acquire physician lists. From our members, we would kind of brainstorm lists that they might acquire. So an example of this is we had some psychiatrists in our group who were able to access a list of Minnesota psychiatrists from I don't remember the name of the group, the Minnesota Psychiatric Association or something. And that's a group that then we went forward and sent a snail mail to coming from these psychiatry members, urging their colleagues to come on board. Or at one point, Elizabeth acquired a workplace list. She worked for a very large medical group in the Twin Cities, and she was able to get the email list of everyone working in that for that medical group, several hundred physicians, and we would just send out an email that looked something like this, just a sample invitation. Dear so-and-so, this is who we are. If you haven't heard of us, kind of explain in our chapter, talking about why we're doing this work, and then asking people to sign on. And of course, they could delete it if they liked, so we didn't feel like this was very invasive or bothersome. I think another area that was useful for us was our volunteer speaker group. The way we acquired this group was by offering speaker training. So we started this pretty early in our chapter, and we probably did it about once or twice per year, where we would have a training. It would be a half-day session, so pretty big commitment, about 4-hour session. And we modeled it on the leadership training that we had attended at the PNHP national meetings. And we basically had a few components to it, things like showing certainly a sample talk was part of the training. But also we spent a fair amount of time just talking about how to be a public speaker, and we would share tips on effective traits of public speaking. And then the bulk of our speaker training was actually sat in a mock Q&A session that we would do, where because we felt like a lot of what might have scared people off from public speaking was their fear of not being able to answer a hard question. So we actually spent a fair amount of time during the speakers training doing mock Q&A, where we would have this list, or not, we didn't need to develop it, it's all available on the PNHP website, but just the tough questions. And we would just practice putting people on the spot in a, of course, friendly way, and having them practice answering tough questions and help each other out when we struggled. Another thing I think we implemented that might have been somewhat unique but also very effective was that for our speaking engagements, we would always set up our members to go in pairs. So there was only one person who was the speaker, but there was another member who would always go as sort of the backup or the support person. And there were multiple reasons for this. Number one, the backup or support person might be someone who's never done a PNHP talk before, and so it was their chance to just get comfortable and see someone do it and kind of see how it actually works. But that backup person also can help the speaker if there's a tough question and the speaker having trouble answering it, that person can kind of step in and help with that. Or they also were the person that helped pass out the resolution with the signers, helped pass around sign-up sheets, things like that. So we always really did our talks in pairs. By doing the training, eventually we came up with a core group of about 30 willing and effective speakers, which really made us able to not turn down invitations and able to do all the engagements that we were invited for. All 30 of them do a lot, but there were about 30 people on the list eventually, but that took time, of course. I'm still hearing a lot of background noise. Is that bothersome to people, or I don't know if there's somebody that could mute.
How do you mute?
If you're on the GoToMeeting, there's just a little green microphone at the top, and if you click on it, you can just mute yourself. So if everybody who's on can just click that microphone, that will be great.
Yeah, mute everyone and then unmute you real quick.
Okay.
Now, Anne, you should be unmuted.
Yep, I am, I believe. Okay, so then we would also always, of course, use speaking engagements to get more engagements, meaning that the last slide of any slideshow was always, please contact us and ask us to come talk to your group. So someone in the audience could then invite us for another group if they were so inclined. We also invited each other. We did, if we were involved in a specialty group, for example, we would recommend a speaker for that group, or if we were whatever hospital we might be affiliated with, we would offer a grand rounds for that site, or just things like that. So we did a lot of inviting of each other. And our interns, who I will talk about in terms of the internship, which is, I think, one of our really successful features as well, part of their job each summer was to solicit invitations, and they would do this by emailing or calling residency program coordinators who were in charge of the noon conference scheduling. And this is a lot of kind of low-hanging fruit for invitations, because residencies need to fill those new conference slots. And this kind of talk definitely fulfills. There's an email actually that Matt or Ida can send you that we used as a sample email to send to the coordinator, but it fulfills ACGME specific guidelines. And so they're very happy often to be able to fill one of their speaking slots. So residencies are a great way to get speaking invites, but our interns did a lot of that soliciting. And then, as I already mentioned, we never let the resolution go unpassed. It was always passed around and distributed at every event. We kept records, which this isn't a slide to, this is, for one thing, it makes you feel proud when you can say, gosh, here's all the speaking engagements we did, but also it's really helpful to make sure you keep track of what you're doing for fundraising purposes. You know, at the end of the year, if you're writing a fundraising letter, it's really nice to be able to say, hey, our speakers did, you know, I think this list is 53 talks this year, and this is approximately how many people we managed to touch with those talks. So keeping records, I think, is important, especially if you're just starting out. Just write down what you do. It's fun to be able to look back. PNHP internship, highly, highly recommended. We did not do this our first few years. We were too busy just trying to get things organized and get ourselves straightened out with running a chapter, but eventually we did have a PNHP, or actually 2 PNHP interns every summer between years 1 and 2. So these are medical students generally. That's who we were targeting. We had some actually non-medical student interns who were great as well, but we always wanted at least one of our interns to be a medical student, because they provided a huge amount of connection to medical students in general, which was a huge feature of why they were so valuable. We made sure that 50% of the internship was devoted to education. So in terms of the hours that they, quote, worked for us, 50% of those hours were devoted to becoming policy and activism experts on single payer. So we used, you know, we devised a curriculum based off the reader, the PNHP reader. So this is a lot of our resources came from the national office in that regard, and then some Minnesota specific things that we would have them read. They did other jobs, of course. As I mentioned, they were in charge of acquiring speaking invitations for our members. They also did their own PNHP talk that they created and gave during their internship. And then they each year there was variability amongst the projects that our interns did, depending on what was going on in Minnesota at the time and what they were interested in. So those are numerous, and I don't have time to go through them, but the internship was great. And for people who are interested in doing this, the national office will provide you with information on payment and all of that. They are paid a small amount, which makes it appealing because a lot of what students are doing during that summer might be unpaid. It's not a lot of money, but it's still nice to have something. And just in general, as I mentioned, the internship was our link or our connection to the medical school. And there's just no doubt that working with medical students motivated us. They're energetic, they're inspiring, and it's just such a great infusion of positivity to come into a chapter to get the students involved. There were many things that they did on their own. There's an interest fair first year in medical school, so they always hosted it, or had manned a table at that interest fair. They organized lunch lectures and student groups that they were involved in. They would invite PNH speakers to come to, and they were very involved in our Day on the Hill. So I think any way that you can bring in medical students, you should. I highly recommend them, and it's just as a general group. And of course, they're the future of the movement, so highly valuable resource. We did do a Day on the Hill every year, which we thought was quite important in our work. We were fortunate in Minnesota to have a state senator who's a single payer expert in himself and champion, and is the author of our single payer bill, Senator John Marty. And so we were strongly connected to him and other legislators who were very supportive of single payer. And we did a Day on the Hill that our members, I think, really enjoyed, in the sense that it gave them a really concrete action that they could do and advocate for single payer. It also was just another way to educate and motivate members. This is a pretty big logistical operation, so we had no paid staff in terms of our chapter day-to-day running, but we did hire somebody always to help plan and execute this, because it is just a lot of or at least in our case, it was a lot of work to set up legislative meetings and all of that. So that was something we didn't feel we could take on without help. And then this is my last slide, actually. And I'm going to say a lot, but there's not much on this slide. You know, I think ultimately for people who are starting chapters or already involved in chapters, you know that the really greatest benefit of this work is the people that you get to, with whom you interact, and you have sort of this automatic group of kindred spirits that you get to be with when you do single payer work. And so not only is it a benefit, but I think the relationships we formed were a real tool to making our chapter successful. I mean, it's what brought joy and energy to the work. And so, you know, to kind of foster those relationships, things we tried to do are sort of obvious, but I think they were important. We tried to respond quickly to and thoughtfully to emails or inquiries from members. And we always made an effort to show appreciation to people by sending thank you notes. We spent a lot of time doing thank you notes. I feel like that was one of our biggest activities. And always trying to recognize people's contributions in a personal way. And then allowing time for social interaction. Your members are going to be people that like each other generally. And so, you know, allowing time at each meeting for people to introduce themselves and talk about a little something about themselves. We did have events that were purely social, like an annual summer celebration that's now morphed into a holiday party. The chapter now is doing regular happy hours, which is great. And then finally, I think being creative in how you utilize people. You know, you may not always have certain skills or talents within your group, but using what you have. And an example of that is how I'm going to end my piece of the talk. After we turned over the leadership, one of our members had a very, I'm switching this on purpose. One of our members had a very close connection to an individual who was very good at making videos, and I thought I had this pulled up, and I did, but I'm just going to pull it up again. And so there's a 1-minute video that they created that they use a lot now, the chapter does, in presentations and just anytime they're doing public work. And I think it's really, really emblematic of this work. Oops, I don't want to do it yet.
No healthcare bills.
I can't stop it.
No confusing plans or restrictive networks. It'll be simple. One quality plan for all of us, for our whole lives. We'll be free to have the job we want, not just the job that provides insurance. We'll be free to see our own doctors and receive the best care for our families when we need it, not just when we can afford it. We won't have to put off seeing the doctor and risk getting sicker. We'll be free to have the care our doctors advise without worrying how we're going to pay. Freedom from financial worry. Freedom to be healthy. Join thousands of Minnesota physicians and patients who are working to make it happen. Help us. We can make this real, right here in Minnesota. Now.
So the point of that, what I was going to say before I started it, although it's fine that it already played, was that, you know, this video they created really conveys a very simple and positive and hopeful message. And so that's just the tone that I wanted to end on, and that was using talents of somebody that was connected to the chapter. So I will turn over my piece and be open to questions later.
Hi, this is Jessica Sachs, and can you all see my slideshow or not? Hello?
Not yet.
Okay, so I got the slideshow up and I lost the window that says to show my screen. I don't know where it is. the slideshow is, oh, wait a minute, here we go. Well, okay, I'm going to show my screen. Okay, now the slideshow disappeared. Oh, wait a minute. There it is. Can you all see the slideshow?
Yes.
Okay, we can see your slides now.
Okay, good. I'm sorry. A little trouble with Windows. Hi. I'm Jessica Shore-Sachs. I am the chair of Healthcare Justice North Carolina. And I want to thank Ann. I was taking notes and I learned a lot from her presentation. So I hope you all will maybe learn something from me as well. We have been in our current form for 3 years, but our organization has existed since 2000. And the main thing that I think that we've been successful in overall is that we have put a map in Charlotte, North Carolina. Several years ago, when I would tell people I was a single-payer advocate, I got the response that probably many of you do, which is people's eyes would glaze over and they would say, oh, isn't that a dead issue? And the last couple of years, more and more, I talk to people who realize that it's a real issue and that there are still people who support it. I'm hearing a lot of buzz and feedback on the line. Can people hear me?
Yes. Yes.
Okay, great. I'll just talk through it. So I want to talk to you a little bit about how it is that I feel that we've managed to do this, put it on the map here. So in this slide, you have a picture of many of our most active members, including our board. This was taken from an organizing workshop that we had in April, and the person in the center is Emily Henkels from PNHP, who came to do the workshop. And that's one thing I would commend to all of you. I think that that was very helpful in getting us together. But I wanted to show you this slide because I hope you see from all these smiling faces what an enthusiastic group of workers we have. And I think that that's really obviously something that's very key to this is having people who are committed and willing to work. So most of the people in this picture are on the board, but a few of them are active volunteers who attended this. Another thing is you may notice there's some diversity in our board. We could use a few more men, but we have people from different backgrounds, and we work hard on keeping some young people on, which I'll talk a little bit more about later. The other thing I want you to notice is that this picture comes from a Facebook page, and that's been one of the tools that we use for organizing. A lot of us who are involved in this are baby boomers, but we have a few younger people who are more adept at it. And so we now have a page. We have friends on our Facebook page. This is one way that we communicate with people. We post. But then, for instance, the thing that you can see on the page somebody else posted is somebody who's not particularly one of our active members, but who cares about this issue and is a friend and stuff. The Facebook page is a means for keeping the discussion. Another thing that we also have a resolution. We stole this idea from Minnesota. I went to a meeting a few years ago that they use in getting people involved. Actually, just right here. We talk to people. And then they automatically become a member of our organization, and we don't have any dues. Once they're members, we first of all, we're supposed to get them onto our website, although that's probably not up to date. But the names get entered on the website, and they do immediately get entered on our Google list for email communication. Is somebody speaking or asking a question? So communicating by email is a way that we keep in touch with our members, and I think this also has been effective in letting people know that we're an active organization and that there are things going on in the single-payer world. So this is one example of a member communication that I sent a couple of weeks ago with an article that I thought was important. And this is, of course, also the way that we let people know about events and also about things that we're asking them to do, like write letters or contact their legislators. Another thing that's helped us a lot is having relationships with the media. And here's one example. 3 years ago, when we launched our organization in its current form, we had Jerry Friedman come and speak to us. And the Charlotte Business Journal covered that. We also got coverage from the Charlotte Observer that I'll talk about in a little bit. And we also got him on Charlotte Talks, which is the local talk program on our NPR affiliate. And generating that kind of publicity, again, has helped keep the issue alive. And it's important both for our members and for people who aren't our members to keep this issue in the public eye. Now, I occasionally write op-eds for the Charlotte Observer, and they've been really good about publishing these, which again has helped. And we have several members who write letters to the editor. So this is just from a few days ago from Dr. DeSantis. Some of you know, because she's been active in the Family Medicine Organization, and this is a response to the issue about the increase in the price of EpiPens. And if you're actually able to read this, I would say that her original letter contained in it a plug for single payer, but they edited that out. She writes occasional letters, and so do a couple of others of our members. We take advantage of every opportunity that we can. And so when Medicare had its 50th anniversary last year, we used that to bring Andy Coates, the president of PNHP, and we were able to generate some publicity around that and letting people know that Medicare was celebrating its 50th anniversary and letting people know about the successes of Medicare. And you can see that we even gave Medicare a cake. And when Andy came, again, we have a good relationship with the medical reporter from the Charlotte Observer. And what she has typically done for our national speakers is interview them a week before they come. So this link, I think this is on our Facebook page again, but this link is the article that she did after talking to Andy before he even spoke. And then she put a note in the article, and it was also listed somewhere else in the paper that we were having this event with him. And when we have a national speaker, we typically have over 100 people come. And this free publicity that we get from the articles in the paper has been a huge help. So another thing that we do is that we've participated in some rallies, and we partner with some other organizations that have similar aims. Now, unlike Minnesota probably, unfortunately, North Carolina has not had the wisdom to expand Medicaid. So there's a big movement here to expand Medicaid, and we are working with several of those groups. And the picture that you see here from this rally is actually a Medicaid expansion rally. One of our board members chairs the state committee, which is called Cover the Gap, which refers to the insurance gap for the League of Women Voters. So we're tied into several other efforts. And we feel that this is very helpful because this helps connect us with people who have similar goals. And also, we feel that by establishing this relationship, that when the time comes to really we get past Medicaid expansion and we want to advance single payer, that we'll have friends in a lot of different places. Now, another one of our successes has to do with Representative Alma Adams. Alma Adams is a really dynamite congresswoman who likes hats, and she represents the 12th district, which until a recent redistricting just included a kind of border of Charlotte. Like, I was not, for instance, in her district. But she visited Tennessee, and Garrett Adams primed her and talked to her about HR 676. And then we organized an effort to approach her and encourage her to sign on as a co-sponsor. So there are 3 members of our organization who were in her district, and they wrote her letters. And several of us talked to her staff, and then we also went to a town hall meeting that she had, and a couple of us spoke asking her to sign on as a co-sponsor. And eventually we were, in fact, successful. And she is the only North Carolina congressperson who has signed on to 676. I want to talk to you about a couple of things that I don't have slides for. One is I want to reinforce what Ann said about the importance of engaging young people, and we've been working really hard on that. I feel like it's really important because single payer is really their future, and they and their friends and their patients will benefit from it. And additionally to people benefiting from it personally, the young doctors of today and the doctors of tomorrow are the ones whose practices will really benefit. That if we can bring in single payer, they're the ones who won't have to worry about whether their patients have the money to see them or whether they have the money for tests or medications that they order, and they will also benefit from the decrease in bureaucracy. So we have really worked hard to engage some students and residents here. And we don't actually have a full medical school. It's only in the last couple of years that we have the 3rd and 4th year of the University of North Carolina at Chapel Hill, and students who spend their last 2 years here. So it's a little bit of a challenge because there are only a few of them and they're not around for long. But we have a couple of very dedicated residents who have been working on engaging other residents and engaging as well, and this is something that we hope to move forward. I'd like to offer also a couple of tips about increasing membership because I saw that was one of the concerns of the people on this call. I would say that publicity helps, events help. Just like Ann, we always pass out our resolution at events. There's some things that you can do. One thing that I do is I read all the letters to the editor in the paper, and every now and then, out of the blue, someone will say this country needs single-payer health care, and sometimes I chase those people down and get them to join our organization. And the other thing that I've found to be effective is I just talk about single-payer almost everywhere I go. But if I go to some kind of a professional reception, or if I go to a political event, I get to talking to people, and it's amazing how many people out there who think that they're the only single-payer supporter in the world, and that they're glad to find that there's actually a local organization. And then that relates to the event I want to show you on my last slide, which is we have a fairly new active member who's on one of our committees, and who's very tied in the community, and she suggested that we participate in parades. So we went to a 4th of July parade that was in a neighborhood, and then also at her suggestion, we went to the Pride Parade. And actually, she is Margie Stewart. She's the person that you see in the colorful shawl on crutches. So this should give you an idea of how dedicated she is. She marched in the parade on crutches. At the Pride event, there were exhibits, and we had a booth. And to my surprise, a lot of people came to our booth And there were a lot of people who actually knew quite a bit about single payer and who said, oh yeah, I thought we should have this for years. We had our resolution there. We had 250 people sign our resolution, which we consider a huge success. So on this happy note, I will stop and I will be glad to take questions, as will Ann.